So now we're talking about sort of structured personality tests. So these are based on sort of psychometric theory. These are tests that were developed as structured tests, like scales that were meant to sort of test personality. There's lots of these. We're not going to focus on a whole ton of them. I'm just going to focus on one of the bigger ones, but we'll talk about a few. Okay. So even like personality, you can take an entire course or even a series of courses on theories of personality. There's lots and lots of them. The general idea is that your personality is some relatively stable and distinctive patterns of behavior that characterize an individual and his or her reactions to the environment. Right? So it's very broad, but personality tests attempt to try to measure these sort of stable traits and try to separate them out from more short-term states that occur. So a state is something that, like, there's state anxiety, which is your level of anxiety at the moment based on a certain circumstance. So if you're about to have an exam, or if you're about to skydive, you expect your anxiety to be high because of the state you're in. But someone's trait anxiety is someone who has a general level of anxiety all the time, regardless of the state. So it's sort of state versus trait. So oftentimes when people talk about traits, we're talking about personality traits, or at least persistent sort of traits that are within them. And even it gets sort of muddied when talking about different aspects of personality. Things like self-concept and stuff can start to come into play. That's why the theories of personality become super complicated. It's a very complex sort of field, and there's lots of disagreement about exactly what makes up a personality and how many things you got to sort of measure to look at personality. So personality traits are these relatively enduring dispositions. So a tendency to act or think or feel a certain manner under any given circumstance, right? And it can help you to sort of distinguish one person from another, right? So then there are personality states, which are predominantly sort of emotional reactions that vary from one situation to another. So states are more variable. They're not very long lasting. These are more reactive to situations, where these are sort of more, sort of permanent personality traits. So when you hear personality traits, what kind of things do you think of? What are some personality traits that you're familiar with? Yeah, so right in the technical, the big five. I always think of it as ocean because that's the easiest way to remember it. But just in general, like, when you think about, that person's got a whatever personality, like there's lots of ways in which we use that term. All right, so we talk about extroverts and introverts. It's a big one. A person is introverted. They tend to be more withdrawn, they like doing things on their own. They rather stay in than go out. There's all these things. And what's funny about that is it also leads us to have all kinds of stereotyped beliefs about what it means to be introverts and extroverts based on sort of what we know about personality. And there's even, some weirder ones. Like, for instance, like, speaking for myself, I don't even know what I am, because I think of myself as being very introverted. I can be by myself for long periods of time and sort of enjoy just being alone. I don't really need to go out. I don't need to be around a lot of, and I find one of the big things about being introverted is that extroverts, people who are extroverted, are tiring. Like, it actually is like exhausting to be around someone who's extroverted. So I have a lot of those most of the time, but sometimes I'm very extroverted, and I can be at a party and be sort of the loud, gregarious sort of person and sort of talking to everyone. And so I tend to, I don't know, that means to me like an omnivert. I don't know. I tend to, it doesn't happen often, and more often I'm much more introverted. And you would think that someone who's introverted wouldn't have a job in which they speak to people all the time, but it's almost like a separate thing. So I do this, but oftentimes, even after lecturing for a while, I do find it exhausting, sort of interacting with people and having to do stuff. I find it tiring, but just because I prefer to be on my own quietly with a book someplace. So that's a good one. Introvert, extrovert. What else? What other traits do you think of as sort of being part of people's personality? All right, neuroticism. So when you hear the term neurotic, what does that mean? So high anxiety and worry and things. No, a lot of the perfectionism, like in extreme, like the OCD that people get, that also stems from anxiety. A lot of it is anxiety as the source. So that, yeah, so people that are neurotic tend to have a lot of worry and anxiety, and they may do a lot of these sort of perfectionism type things to help to reduce the anxiety, versus people who are very laid back and easygoing and don't worry about anything, right? I've often joked with my wife where, you know, two of us are, like any relationship, is often sort of a complementary aspect. So I'm very laid back about most things, and she's much more sort of high strung about things. And I always talk about that, like her like level of relax, we're on vacation, relaxed by the pool, doing nothing, relaxed. That her relaxed level of anxiety is like my maximum anxiety. Like, so she still sort of have a level of anxiety, even like on vacation with me. I'm just like, that's like when I'm the most stressed out is still probably less than her relaxed. So we're at very different energy levels in terms of easygoing versus sort of high strung. Even though she likes to argue that that's not true, it is. Anyway, what else you got? Neuroticism. Sorry, I'm not purposely trying to like talk over you or to steal the thunder. It's just on the recording, you're not on there, so it's just me. So I'm trying to like fill it in, make it interesting with stuff that people can hear. What else you got? All right, it's neuroticism. All right, so optimism, you got optimistic versus pessimistic. You can see that a lot of these are on these sort of these continuums, where most people aren't on the extreme ends of either one, but they do sort of fall to one side or another. You know, like conservative, liberal, you know, all these sort of these continuums can be seen as reflected in someone's personality, because it does seem to be rather constant. They always seem to be that way. And if you've ever seen, even though sometimes you got to be careful of some of the personality traits, something that you think is a personality trait may be completely state-oriented, you just don't know it. So I'll give you, for instance, have you ever had a classmate or a family member or someone you've worked with or something where they seem just like, you know, grumpy, bad mood all the time, they don't seem like a whole lot of fun, until you get them out of the office or out of the classroom or whatever, and you go someplace else, and all of a sudden they're a totally different person. They're like more fun, they're whatever. So something you thought was a trait, really you figure out they just hate the job. They hate being there, they hate dealing with stuff, so they're always in a bad mood because of that. And outside of that, they're now all of a sudden a different person. So it's very state-oriented, even though you thought it was a trait, because you only know them or only see them in that particular state all the time. So sometimes you got to be careful with that. Any others you can think of? So we got optimism, pessimism. If you look at the big five, you know, you also got agreeableness, which is, again, you're likely make it sort of simple, how agreeable you are. Are you more sort of go with the flow and help people and be more agreeable, or are you more sort of difficult and want to fight against people and not agree? You got conscientiousness is another one that comes along in that sort of big five. Yeah, and even those stable, even things that you if you argue that there are stable traits, those traits can be shifted one direction or another based on the state. So even if you believe there are stable traits, they are sort of somewhat state dependent. You know what I mean? So yeah, again, the difficult part with personality, and something I'm trying to avoid getting into, is that there's very little agreement about personality. It's one of those areas in which people are just like, no, I don't think so. It's like this, and everyone's got their own personal sort of opinions about it. I'm trying to keep, you know, away from those and talk about just in general, these are the kinds of thoughts people have. But yeah, I mean, it's easy to argue that really what you're seeing as a stable trait is that someone's just in that state all the time. So if you were to change their state, you'd see a very different personality. So then is it really personality, or is it just the state? So it becomes complicated. All right, let's move on. We're never going to finish this stuff. You got personality type. Oh, by the way, the other ones what I thought of, right, I started to say when you responded was people often have a lot of these different continuums you have, even sort of masculine and feminine can be seen as sort of personality traits because they're sort of ongoing, they're whatever. And people might argue, well, that's also very culturally dependent and stuff, but yeah, so are most of these. So even what we see as someone being agreeable or conscientious or neurotic, all of those are sort of culturally dependent on how we define sort of too neurotic or something. So there's a bit of culture and that lens on everything. And a lot of it is sort of trained. I mean, so, yes, it could be an inborn, innate state in somebody, but it also could be their environment. They may have a parent who's also, pessimistic, and that's sort of how they learn. So there's all kinds of debate about how these things come about. So we got, lots of personality types, and these get interesting. Because again, it's almost like we're sort of stereotyping folks. We're finding sort of commonalities between them and sort of labeling them with these sort of personality types, like an avoidant personality type or a depressive type, or all these different types of personalities. And there's a million of these like questionnaires on Facebook or Instagram or other social media sites. You're going to find a lot of these, take this personality quiz or whatever, and tells you, whatever. It's just, people seem so interested in that. And again, it goes back to this idea of, with like diagnostic stuff, that if I can just figure out what it is, like if I can diagnose the issue, I can figure out what kind of personality type I am, then I might be able to figure out a way to help myself or to do things differently. Like if I'm a depressive type, I might be able to to address that. Knowing that that's true, I can figure out how to avoid falling into those sort of depressive sort of slumps and things. Anyway, self-concept is a person's self-definition, sort of how they see themselves, an organized set of assumptions one has about him or herself. And it's interesting because oftentimes how other people see your personality may be very different than how you see your self-concept. So it's interesting. It's very, very odd that way. Most people that know me as part of this job, right, that I speak in front of people. I talk in front of large classrooms. I mean, in the summers at UCLA, it'd be 100. I think I've had 120, 150 people in a classroom. Whatever. I can go and talk to people all day long. I've been a musician my whole life. I've played in front of large crowds. I've played in front of empty crowds. But I can be in front of people in that way without a problem. People think of me as being very outgoing and very extroverted because of that, and I don't feel that way. I'm actually very introverted, and I don't mind doing that kind of stuff because I feel like it's sort of one direction. Like I'm just sort of either playing the guitar and singing or whatever. It's going one way. But when it comes down to being in a small group where it's conversation, I have much more difficulty with that, and it actually makes me more anxious to have to deal with navigating social situations. So my self-concept oftentimes is at odds with other people's self-concepts or other people's view of my personality, which is interesting. So that's to point out that how you see yourself and your own personality traits may be at odds with how other people view your personality traits. And maybe that's because I'm not very good. Maybe I'm not very introspective. Maybe I'm just bad at knowing what I'm really like. Maybe I really am an extrovert. I just assume I'm not. I don't know. But there's oftentimes a mismatch between these two things. And I think people are happier, more well-adjusted, the closer these two things get. The way people see themselves and the way other people see them, the closer those two things are, the more they match, the less likely you are to be in situations where that leads to problems, right? All right, I got to move forward. So most structured personality tests attempt to assign a personality type based on upon measurements of someone's personality traits. In general, a subject is asked to respond to some objective written statement that is designed to minimize ambiguity. This is different from projective tests where subjects respond purposely to ambiguous stimuli. So we don't want this to be ambiguous. We want this to be as clear and as concise as possible. And you're going to go through and answer questions. Usually it's yes, no. It's like you're indicating your agreement versus your disagreement on a question. And you answer many of these, and depending on the combination of items you've responded to, it sort of gives you an idea of your personality type or the types of personalities you may have. Like, think about the big five. You may have different ends of each of those spectrums across all five of those big five personality traits. So there are two big approaches to structure tests. There's the deductive test, which is more sort of clinically oriented or sort of based on clinical expertise, where they sort of deduce what items would indicate what kind of personality. And then you got a more empirical approach, which is based on things like factor analysis or other things like that. Anyway, so when it comes to these sort of structured tests, there are these two approaches. One is sort of more empirically based. The stuff we're talking about here. This is more based on sort of psychometrics, classical test theory, factor analysis, maybe that kind of stuff. Or deductive is really based more on the expertise of clinical psychologists and trying to find items they think would measure specific personality traits. Okay. So in looking at the sort of the two different kinds, and we're going to talk about these more specifically, deductive, you got the sort of logical content approach and you got a theoretical approach. So the logical content, there are these sort of, content, intuitive and rational approaches to developing items. We'll talk more about that in a second, versus more, based on some overall theory of what the item should look like, right? And then you got this sort of criterion group where the idea is if you've already put people into different groups, these people, you have a group of people who are neurotic, and you get a group of people aren't. You find the items that differentiate them the best. They have the highest discrimination, and so that's what the criterion group is. So you use contrasted group. There's external strategy, empirical strategy, criterion keying. All these are different ways of looking at this sort of criterion group approach. And of course, there's a factor analytic approach. This is much more empirical as well, looking for items that sort of go together. So this is really more looking at the items that share the most sort of variation together, when these are looking at the items that are actually able to tell people apart the best. Okay, so let's look at those. So logical content uses reason and deductive logic in development of personality measures. All right, that already makes me nervous because whose reason and what deductive logic becomes, interesting. But a test designer attempts to logically deduce the type of question that should be asked to measure the hypothetical concept. Okay, so example, I freely worry about my weight. I feel bad after I've eaten a good meal. So these, if you're looking into something like weight loss or trying to get at something where people have issues with self-control or something like that, these types of questions could be logically deduced as being something that would indicate that. Here's the thing, it relies heavily on face validity, right? So the questions should look like they're logically asking about that thing that they're trying to measure. Does not rely heavily on psychometric development, which is also a little bit scary, right? So they don't really do anything to sort of validate it or to look at reliability. They assume that because it looks like it's measuring about something like weight or self-control or something like that, then it must be. All right. With theoretical, at least, you're now starting with a theory. And so you can think about this as sort of more domain sampling sort of an idea. You have a theory, you ask questions that are consistent with the theory, assume that every item in a scale is related to a characteristic that you are measuring, and you're attempting to create sort of very homogeneous scales, and you'll use things like item analysis and stuff to confirm it. Right? So this goes as far as looking at things like difficulty discrimination, trying to look at those things to see if items are actually working, maybe in Chromebox Alpha and that kind of stuff. Okay, but at least here you're starting with a general theory. Hopefully it's something that's backed up by like the DSM or something, so that you actually have a basis for where these questions are coming from, and then they get developed and you try to test them out that way. All right. So of course, in a psychometrics class, I'm going to spend more time talking about the sort of empirical strategies. So the criterion group strategies start with a group of people who share a common characteristic, like they are aggressive or they're depressed. Select and administer a group of items to everyone in the criterion group and a control group. And then the items that stay, that get kept on the scale, are those that are the best at telling the control group and the criterion group you're looking for apart. That have the extreme group method, right? They have, that more people in the criterion group are answering the question correctly, or they're endorsing the item, whatever it is however you want to say it. And very few people in the control group are. Those that tell those groups apart the most, then are kept. And this is where you actually can get items that may on the surface make no sense. You're like, well, how does that differentiate between these groups? Because the content doesn't matter. It's based solely on the differentiation between the criterion group. So it worries less about why it's related to that differentiation than it does just sort of identifying that it does that. So that's what I was saying before, this scale that I don't know, the love languages or whatever it's called, it's possible that some of the items or some of the content doesn't seem to make sense, not because they're just throwing things out there. It could be because they're using some the strategy like this, and they just found that those items actually differentiate between people of different types or different groups, different criteria, and they've kept it in because it seems to differentiate between them, even though they may not know why. Right? So it can sometimes be seen as sort of theoretical, because you're just throwing a bunch of items at these groups and seeing which ones seem to stick, and whichever ones stick, you keep them, regardless of what that means, right? So it goes in the exact opposite sort of than the logical deductive sort of approach. You get a factor analytic strategy, which uses factor analysis to derive the empirically the basic dimensions of personality. With both of these, here it says, ask a large number of questions. Well, this asks a large number of questions too. In order to figure out what questions really differentiate between people on aggressiveness or depression and stuff like that, you really have to throw a lot of questions at them too, right? So you get to figure out which ones have the most differentiation or most discrimination. You got to throw a lot of questions out there. And the same thing here. You start with a large number of items. You start to look at which items seem to hang together, which items seem to go together the best. And those are the ones that sort of you keep. The ones that have the highest loadings and things are the ones that sort of go together. So it looks for correlations among questions. There's also we didn't get into a whole lot of this in factor analysis, but there's other issues too. You want loadings to be high, but sometimes you can get items that are so related that they can actually cause issues. So you can also eliminate some items because they're too related. They're basically redundant. So anyway, if groups of questions are correlate with each other, then this is evidence of an underlying sort of latent factor, and then that would sort of then be the start of sort of at least quantifying that this latent variable, this factor, this this concept exists, and these items seem to be measuring it. Now, whether or not you then have to validate it to prove that it is the thing you want, but at least these items are going together and measuring the same thing. It just may not be the same, may not be the thing that you think it is, but they all go together at least. So that's what this sort of factor analytic strategy is sort of looking at trying to find those patterns, and it's really relying on that. So lots of items, let's find some patterns. Let's get rid of items that don't seem to relate. Let's get rid of items that seem redundant. And find a nice core set of items that seem to be measuring the same trait, the same factor. What I don't have in here, the factor analytic strategy also includes sort of item response theory. So I mean, you could think of this as sort of a latent variable strategy. So factor analysis, latent item response theory also does this, and it's being used more and more to look at stuff like this too. I just didn't include it here because we didn't really talk about IRT, but IRT is part of this more empirical approach to try to find a core set of items that actually measure the same trait. And it even applies more so because item response theory is often, instead of being called a latent variable model, like down here I have latent factor, latent variable model, IRTs thought of as a latent trait model. So it actually seems to fit a little bit nicer with looking at things like personality traits than even factor analysis does. All right, so logical content test example. So we talked about this before, and an example that I took, I think, from the first lecture we talked about. This is called the Woodworth Personal Data Sheet. And they would go through and answer yes or no to a bunch of questions. It's considered the first personality inventory. It's based on a faulty assumption that responses can be taken at face value, and it produced a single score, right? So they're either they were high or low on whatever this measured, personality, right? So I wet the bed. I drink a quart of whiskey each day. I'm afraid of closed spaces. I believe I'm being followed. People are out to get me. Sometimes I see or hear things that other people do not hear or see. There's a lot more of these. But you can start to see where the face validity of some of these items may make it so that people don't answer honestly. You may try to fake better, or fake good, fake bad. If you're an adult and you wet the bed, you're probably not going to indicate that you do, right? Same thing, if you drink a quart of whiskey a day, you're probably not going to indicate you do that and say no, just to, so especially if this is something that's going to a doctor or potentially your employer or other things, you're not going to be super honest. That's one of the faults with this whole thing. So some other logical content tests, some early scales. One of the first multi-dimensional scales, something called the Bell Adjustment Inventory. So 1934, it assessed adjustment in different areas of life. So adjustment to home life, adjustment to social life, emotional functioning. See some of the items here. There's a lot more items, just a few. So do you have many headaches? Is your mother the dominant member of your family? Have you ever felt that someone was hypnotizing you and making you act against your will? Do you ever feel that there has been a lack of real affection and love in your home? Right, so those are all sort of Bell adjustment inventories. And it's the first multi-dimensional one because it's the first one that actually looked at a variety of adjustment scales. And this is something that was developed in 1934. It's been revised somewhat, and I think it's actually still used somewhat today. I mean, even still. I have no idea how to pronounce it. It's probably the Bernreuter Personality Inventory, 1958. Here is another sort of multidimensional scales, items pertaining to 6 personality traits like introversion, confidence, sociability. So here you start to see, things like extroversion, introversion, and stuff like that sort of come into play in this personality traits. And those in red there is do you like to be with people a great deal? Do you usually avoid asking for advice? All right, so it's getting at certain things, different personality traits, and it has a multidimensional scale. And then you got the 1950, you got the Mooney problem checklist. One of the few still in use. It's much like the Woodworth, and it's just you go through and check off things that apply. So, all the things that, all the problems that apply to you, these are all sort of written in negatives. All right, so you're checking off all the problems. So like, don't get enough sleep. Girls don't seem to like me. Parents favoring brother or sister. Now, the other thing that's not mentioned here that probably should is that you can start to see that depending on who is answering it, especially the gender, the sex of the person answering it, should and probably does impact the way it's scored. Because if you're a girl and you say that girls don't seem to like me, that's an issue with maybe friends, associates, or if you're male or a boy and say girls don't seem to like me, that's a different, right? So you may be getting a different indication there. And I always tell my kids, so there's a point, I have 2 kids, my son's 14, my daughter's 9 at this point, and there's all these times where they've both argued that we favor the other one. So like my son will say we favor my daughter, and his daughter will say we favor my son. And I said to my wife on a couple occasions that I feel like we must be doing a pretty good job. If both kids think we favor the other one, we must be doing something right, I guess. I don't know. But this idea of parents, favoring brother or sister, it's likely that if you ask the brother or sister, they'll probably say the same thing, or there's a possibility there too. So some of the stuff's sort of difficult to decipher somewhat, and how accurate it really is. But things have come along more so. There's also in terms of the Criterion Tests, let me go back a second. These are the logical content tests. These are still the part of let's deduce items based on what we understand about these personality traits or the theory that we might have about them. So now we're getting to the Criterion group test. These are tests that were developed by trying to separate people out in different groups. So you had to have a group of people you already knew were depressed or already knew were neurotic or whatever, and try to differentiate between them. So the MMPI was one of them. It was originally developed in 1943. We're going to talk about that more in a second, so let's come back to that. So there's the California Psychological Inventory. The CPI, originally developed in late 50s, circa 56, 57. It was originally developed to identify personality traits of normally adjusted individuals. Used criterion groups for some of the subscales, compared to men and women, homosexual men and heterosexual men. Produces 20 personality continuums from extroverted, conventional, unconventional, dominance, capacity for status, and sociability. This one's an interesting one, capacity for status. Like, are you actually driven by an idea of status signaling things. Like, you're more likely to buy like this one. I like tall women. So I like tall women as an indicator of somewhat of a capacity for status, which is if you're a male who has a preference for taller females, then that's not the only one, but it's one of the ones that sort of indicates that you have capacity for status. I certainly feel useless at times. Anyone who is able to work hard has a good chance of succeeding. So there's all kinds of different ones. It produces 21 different continuums, and when the MMPI was being developed, there was some cross pollination between them because it shares over 100 items with the MMPI. So there's a lot of overlap between the California Psychological Inventory and the MMPI. All right, so let's talk about the MMPI. And the reason I pick on the MMPI because it is a I don't know, it's an institution. It has become one of the largest sort of consistent sort of personality measures, and it does a lot of things for personality and other psychological disorders and things that and it diagnoses stuff all at the one time. It's a massive test, and it does all kinds, reported to do all kinds of things. So, and this may be a little bit dated. There's probably, there may be another version that comes after this, but the general idea is sort of there. MMPI, you got the MMPI, MMPI-2, the MMPI-A, where the A is sort of an adolescent form, so the questions are shifted. Obviously, you can't ask some of the same questions you do for adults. And the purpose here is to distinguish normal responders from abnormal responders. So again, this is already an issue where, you know, people already, especially more recently, have issues with this idea of normal and not normal. People get all kinds of crazy about just using those terms. And yet this was the goal of this test, was to figure out, okay, what does a normal responder look like, and compare those and be able to differentiate between people who are abnormal, respond in a way that is not normal. Because again, what you consider normal has all kinds of conditions on it, right? There's cultural differences about normality. There's differences between even just males and females, differences across ages. I mean, normal becomes a difficult thing to really define, but that was the goal here, was to try to differentiate between normal and abnormal responders. Okay? So, like with most tests, they tried to target the reading level at about 8th grade. All right, so you have to have at least an 8th grade reading level to be able to take the MMPI-2. The original MMPI required a 6th grade reading level, and there's an issue here too. The reading skills since 1943 have dropped. So their argument, at least at some point, was the 8th grade 1989 reading level was really the 6th grade in 1943. So it's really the same reading level. It's just what we considered 6th grade then, 8th grade now, is the same, which is kind of scary. Anyway, the average reading difficulty for the MMPI-2 items is approximately 5th grade, although, so meaning, you know, if you're actually, it requires an 8th grade reading level, but if you actually look at the questions, the difficulties, really most of them are really at a 5th grade level, so it's not even as difficult as 8th grade anyway. 90% of the items require less than a 9th grade education. So even though there's some variety in the difficulty, not the difficulty in responding to the item, but in understanding it, you know, the majority of them actually still are at an 8th grade or lower. And they do have versions that are strictly auditory, or interview forms are available if someone can't read, or if they're blind or something like that. There are other formats in which you can actually do it. You don't actually have to read it and respond to it. The original MMPI began, when I was talking about this, that these criterion versions, these criterion contrast scales or whatever, you have to start with a large number of items. They started with 1,000 questions drawn from case histories. So they looked at case histories of a bunch of different disorders, psychological reports, textbooks, and all kinds of things that describe different kinds of disorders, and they developed statements. They call them questions, but really more statements. And I'll show you some examples in a second. That seemed like they would differentiate between someone who was, quote, normal and abnormal in this particular way in terms of different types of disorders. There was 3 of them to start off, a medical psychologist and a neuropsychologist. Sorry, there's 2 of them, 2 working together. They're both at the University of working in Minnesota hospitals, and they started to go through these sort of case histories and all kinds of stuff to try to figure out what seemed to differentiate people of different disorders from regular sort of quote unquote normal adults and things. They start off 1,000 of them. They narrowed the pool down to 504 items they thought to be relatively independent. So the first thing, they start off with 1,000. They figured about half of those are redundant. So they removed the sort of redundant items to get things that are relatively independent and are covering, 504, different sort of threads of indications of these different types of disorders. And from the 504, they administered all of those to 800 patients representing the following psychopathologies. All right, so these are the ones they sort of targeted at first. They got the hypochondriacs. Right? Patients who are overly concerned with bodily symptoms and express conflicts through bodily somatic symptoms. So you've probably heard someone be called a hypochondriac before. Usually someone who's so worried about being sick. I could not imagine being a real clinical hypochondriac during the current time, because holy mackerel! I mean, your quote unquote normal folks are freaking out and acting like hypochondriacs, so the hypochondriacs must be in super overdrive. You got people who were depressed, so they're depressive patients. You got psychopathic deviants. These are patients who are antisocial and rebellious and exploit others without remorse or anxiety. So these are your sociopaths or psychopaths. Okay, so they use them as well as part of the 800 patients. They also found people who are paranoids. This is their sort of description, but I imagine they mean paranoid schizophrenics, or something like that. Patients who show extreme suspicions and delusions. You got psychasthenics, who are patients plagued by excessive self-doubt, obsessive thoughts, anxiety, and low energy. And schizophrenics, patients who are disorganized, highly disturbed, out of contact with reality, hallucinating, and have poor relatedness skills. Okay. With me so far? So they gathered up. Oh, sorry, there's one more. And then you got the hypomanics. These are patients who are in a high energy, agitated state with poor impulse control. It should be hypermanics. Hypomanics sounds like it should be the other way around. Inability to sleep and poor judgments. This may be a typo, because hypo would seem like it'd be below. If you're hypomanic, then so hypermanic. I don't know, whatever. Patients who are, so forget about the term so much, but they wanted people who are in a sort of manic state, right? They were super agitated, high energy, no impulse control, inability to sleep, poor judgment. And they took them, these 800 patients that represented these, 1, 2, 3, 4, 5, 6, 7 different disorders. And they had them in this group of 800 patients, and then they got an additional 700 controls, and these are mostly visitors and relatives of patients at the University of Minnesota Hospital. Were also administered the same 504 questions. And after an item analysis, items that separated the patients from the non-patients were included on one or more of the clinical scales. The items were then cross-validated on independent samples of the criterion and control group. So they did it again. I don't have how many, but they did it again where they found other patients with with similar disorders and controls. They did it again to validate it. And those items that discriminated between the two groups significantly were then retained. And what you get, I think it was 300 and, I don't have it. The last bit was there were 300 and something questions that remain. I don't remember exactly how many. But here is an example. Again, they're like statements that you either say true or false. So I like mechanics magazines. I have a good appetite. I wake up fresh and rested most mornings. I think I would enjoy the work of a librarian. I am easily awakened by noise. My father is a good man, or if your father is dead, my father was a good man. I like to read newspaper articles on crime. You get the idea. All these different statements. Now, it's hard to think. I like mechanics magazines. Difficult to figure out which one of those. You got the hypomanics, you got the schizophrenics, the psychasthenics, the paranoids, the psychopathic deviants, depressives, and hypochondriacs. Which one that might be differentiating between, but it must, if it's there, it must have been kept for some reason. So you got, you know, my sex life is satisfactory. I work under a great deal of tension. So all of these items were kept, retained, because they actually differentiated between the abnormals, the people in these diagnostic groups, and the controls that they used. And so they were retained. Now some of them are a little bit difficult because they have other scales. We'll talk about in a second. So they kept all these different these items that differentiated between them, and then they added some other ones. So in addition to the 8 clinical scales that they did, because looking at all these differentiating between those diagnosed with disorders and those who weren't, they also had a masculinity femininity scale that contained items differentially endorsed by men and women. It's social introversion, measures sort of the introversion extroversion aspect. And then they also had these what they call validity scales, where they address concerns regarding the logical content approach. You know, they were trying to make sure that people aren't, you know, looking at the items and responding in a sort of reactive way, like trying to lie or fake good, fake bad. All right, so a lot of the stuff is that. So the lie scale is designed to detect individuals who attempt to present themselves in a favorable light. So the lie scale is trying to look at people who are trying to fake good. So not empirically constructed, but logically constructed. So this isn't something that came out of the criterion contrasting. It was based on, you know, these are the kinds of questions people would lie on to make themselves look good. In frequency, it was designed to detect individuals who attempt to present themselves in an unfavorable light, people that try to make themselves seem more sick or ill than they really are, likely to try to get a diagnosis or to try to get admitted or try to get help or things that they wouldn't get otherwise. And then the defensiveness is this measured test-taking attitude designed to detect those who are trying to fake normal. Sounds weird. Who's someone who actually has an issue with it, trying to look as normal as possible. To create the case scale, Hathaway and McKinley examined protocols of disturbed individuals who produced normal MMPI patterns. Those items left over that differentiated between the two groups were included in the case scale. So they're trying to figure out, these are people, they looked at people who they knew were diagnosed with something, like they were either schizophrenic or, you know, hypomanic, or they're in one of those categories, but their MMPI protocols actually looked like the normal folks who were responding. They then they looked at those and tried to figure out from those then items that can actually indicate those that were trying to fake sort of normal and look as fine as possible. So these are the many scales. There is a hypochondriasis scale, depression, hysteria scale, a psychopathic deviant scale. You got the masculine femininity, you got paranoia, the psychasthenia scale, the schizophrenia, the hypomania, and then you got the social introversion scale, and then you got the sort of the lie and frequency defensiveness scales that were present in the beginning of the MMPI. So when scoring this, lots and lots of questions. It's going to be difficult to score. So questions that contribute to each scale are added up to obtain a raw score, right? So any item that was on, say, that was designed to be in the hypochondriasis scale, they added them up, and then they would convert those items to what's called a McCall T-score. So McCall T is just a specific scale, sort of like a Z-score scale, but it just has a specific mean and standard deviation. So they would convert them over to have a mean of 50 and a standard deviation of 10 based upon scores from the control group. So they would use the information from the control groups to then convert all the scores over to having a mean of 50, standard deviation of 10. And then scores above a T-score of 65 then are considered clinically significant. So they would get scores on every single one of these, and any of them that popped up above 65 on the McCall T scale, well, then they'd be considered clinically significant on any one of those scales. So you can see up here, it's not very good, not very easy to see, but you can see that would actually plot out sort of profiles for people. And anytime you have places where things sort of spiked, would tell you that that's a place of sort of an issue. This one looks like it's maybe on depression or something. Here, anytime there's a spike, it looks like this person, this person's trying to fake bad. The frequency scale somewhat here. They have a spike on that one too. Anyway, original goal is a single spike in a patient's score will lead to a clinical diagnosis, right? So you would take the thing and they would give you a spike on one of the scales and they would tell you that person had that diagnosis. If it was on a depression scale, the person was clinically depressed. If it was on a hypochondriasis scale, the person was a hypochondriac. You get the idea. Schizophrenics would show a spike on schizophrenia. Hysterics would show elevation on hysteria. The assumption turned out to be false, in that in reality, most profiles produced multiple spikes. So it was more likely if someone had an issue, like say they're a hypochondriac or something, or let's say they're schizophrenic, they wouldn't just show a spike on the schizophrenia scale, they would show spikes on other ones as well. And sometimes a person would show elevated levels on all of the scales. Imagine that. You take this, and all of a sudden now they have a McCall T-score. They just have spikes that are on every single scale the way across. So it didn't do what it was supposed to. Its original goal was to show single spikes to identify where the issues might be. So single scale interpretation is therefore generally not possible. So they started then looking at configurable interpretation. They started looking at the patterns. Right, and they started looking at, like in 1951, they started looking at a 2-point code. Like, so if you're high in these two different scales, then that was really more about this kind of diagnostic. Right, so generally, started research looking for common characteristics of individual profiles with common two highest T-score scales, because the one scale thing wasn't cutting anymore. So I started looking at two of them. So in a general strategy, if there's a defined spike, interpret it first, like the one that's highest, then look for 2-point codes that might indicate more specific types of diagnostics that might co-occur. Like a person may have maybe a hypochondriac with some, depression and anxiety, right? So that you can start to sort of get a more specific diagnosis based on the cluster of their spikes on across the scales. The MMPI-2 was, re-standardized in 1982, and what resulted was a second version. And what they really wanted to do was revise the norms, because they were trying to figure out what is normal versus abnormal. And at that point, when it was first developed, as a male that was sort of high on femininity or something like that, maybe homosexual or something like that, maybe would likely have been seen as a deviant and diagnosed with something based on the DSM at that time. So there's lots of things that changed. So they had to renorm things. They had to redesign the scale to sort of fit the changes, not only in people's expression of things, but also in how things were defined in terms of the diagnoses they were trying to sort of get at. In terms of psychometrics, if you look at a median split half reliability, coefficients run at 0.7, some as high as 0.96, but most lower. Median test-retest reliability, they're 0.5 to 0.9. Most of them are about the 80s. The factor analytic coefficients running in the high 0.9s. This is tricky though, because the items are just dichotomous. So it actually takes regular factor analysis is going to be grossly underestimated. So it takes some special, I don't know, what's the word I'm looking for? There has to be some adjustment to the fact that dichotomous items, and it really makes more sense to do something like IRT. Reliability is generally considered adequate for a psychological measure. It's not great, but it's considered good enough for what they're trying to do. There's been tens of thousands of validity studies pointing out the diagnostic specificity for a range of problems, including substance use, alcoholism, post-traumatic stress, delinquent behaviors, all kinds of things, right? It's probably the most widely studied personality test worldwide. A big part of that's because the tests go out and then they have to come back to the testing center to be scored. So every time a test goes out and it's used somehow, it goes back to testing. So they have this massive collection of people that haven't taken the MMPI. So they have this massive sort of warehouse of data on the MMPI that they can then use. My advisor at UCLA, when I was there, we looked into some of this stuff, comparing men and women and boys and girls on different clinical scales, and we were looking at 35,000 respondents, 35,000 men, 35,000 women. Use these massive samples because they just have all this data because everything has to go through one place. So instead of the researchers sitting on their little cluster of data, even though they may have that, all the data also had to go to the scoring facility, so they also have a massive amount of data there too. So lots and lots of studies, lots and lots of psychometrics. Just to shift gears because we're running out of time, quick here. Just to think about the factor analytics strategy and how that sort of come about in personality testing. One example where it was sort of driven, factor analysis was also sort of developed alongside this sort of process too. So they both went sort of hand in hand. So Cattell developed what they call the 16 PF. I think it was the 16 personality factors scale. Began with all adjectives applicable to humans. So he just took a bunch of statements that all apply to human beings. Okay, and it was 4,504 real traits. Cattell reduced to 171 items he believed accounted for all the other items, meaning that he tried to break it down, try to eliminate redundancy and all this stuff to get down to 171 sort of separate things. And then the 171 items were administered and came back with 36 surface traits. Subsequent factor analysis produced 16 distinct factors that accounted for all of the variables. So he went from 4,504 to 171 to 36 to 16 factors that sort of explained all the different things. So this was really empirically driven. Again, we're breaking down, looking at pattern things based on factor analysis. And here's some of the items as you get an idea. I take time out for others. I know that I'm not a special person. I take control of things. I try to forgive and forget. I keep in the background. I don't know, that's a weird one. I can't do without the company of others. I trust others. I'm not easily frustrated. I cheer people up. I'm often uncomfortable around others. And there's lots and lots more. So you can sort of see the difference here, but this is scored on a Likert scale. So the reason why this works to factor analyze this is because this is more of a continuum, because factor analysis does require items to be continuous and form correlations, like Pearson product moment correlations, which assume continuous items. So Cattell could factor analyze each item and look for these 16 different factors because of that. The MMPI was just true or false. There's no continuum there. All the correlations are going to be truncated. It's going to be difficult to factor analyze unless you make some adjustments. Okay? So the problem with the factor analytic strategy is the subjective naming of factors. So remember, this isn't going necessarily into and saying, look, I have this factor, and here are the items I want to measure it. It's just saying, look, I'm just going to throw 4,500 things. I'm going to throw just a ton of things at the wall, and I'm going to let the exploratory factor analysis tell me which items go together, which I then have to interpret. All right, so since the main goal of factor analysis is to identify common variants, what is identified as common as opposed to unique may be a product of which items are being utilized, the extraction, the rotation, the process in which you go through it. So you have to go through and sort of figure out what these factors actually are just by looking at the item content and figuring out why they go together, which may not be very easy to do. And you're going to have items that sort of don't make any sense on factors. That happens quite often. So this is almost too empirically driven because you're allowing the math, the factor analysis sort of process to make all the decisions for you. And that's not really true because you're allowed to choose the number of factors to extract. There's things you can actually do to impact this. And what's been shown over and over again is that if you take something like this, some large number of items, and give it to different people and have them factor analyze it, what oftentimes will happen is they'll come back with different answers for what their factor structure looks like. For a long time, I mentioned this in the intelligence testing lectures, that for a long time people argued, was intelligence one thing, like a general factor, versus specific factors? And people would take the exact same items, the same data on intelligence, and would argue back and forth that they've proven that it's one factor, and the other person would be like, no, I proved that it's 5 factors using the same data, but because they made different choices about how to identify common variants, how to do the extraction, what kind of rotation, all that stuff will lead to different answers. So the factor approach, while being empirical, is not perfect, and it does require a lot of subjective choices and things as well. So this could also be problematic. So it's not like it's a magical answer to everything, except as you move more towards confirmatory models, you can get a marriage somewhat of like the more logical approach and be able to, even the criterion contrasting sort of approach, you can then back those up by using something like a confirmatory factor model or item response theory to show that the items actually do go together empirically. So there's a little bit of a balance of both. All right, but neither one of them alone seems sort of perfect or is completely conclusive.